Bismillahirrahmanirrahim and Assalamu alaikum. You are watching to Veterinary Science for You channel with Dr. Muhammad Altaf Hussain. If you are new on my channel, so subscribe the channel and click the bell icon to receive more such informative and new videos related to veterinary and animal sciences. Today in this lecture we will discuss lipopeptides class of antibiotics in detail. So lipopeptides class of antibiotics consist of a linear or cyclic peptide sequence with either net positive or negative charge, to which a fatty acid moiety is covalently attached to its end terminus. They are a class of antibiotics which are highly active against multi-resistant bacteria. They are able to self-assemble into different structures. Many bacteria produce these molecules as a part of their metabolism, especially those of the genus Bacillus, Pseudomonas, and Streptomyces. It is a general trend that adding a lipid group of a certain length, typically carbon 10 to 12, to a lipopeptide will increase its bactericidal activity. Lipopeptides with a higher amount of carbon atoms, for example 14 or 16, and its lipid tail will typically have antibacterial activity as well as antifungal activity. Lipopeptide detergents, LPDs, are composed of amphiphils and two alkyl chains which are located on the last part of the peptide backbone. Types of lipopeptides. So broadly there are three types of lipopeptides, namely surfactant, iturin, fungicin. All strains of Bacillus subtilis produce this family of lipopeptides. History of lipopeptides. So the group of lipopeptides isolated during 1950s and 1960s from Bacillus species. Lipopeptides were approved in the USA as antibiotics in the year 2003. Daptomycin, the first cyclic lipopeptide antibiotic, was approved in USA by Food and Drug Administration, that is FDA. These contain more than 20 different peptides linked to various fatty acids. At present, more than 100 different compounds can also be described. Examples are members of lipopeptides class of antibiotics include bacillomycin, daptomycin, echinocandins, for example capsofungin, iturin A, mycosubtilin, surfactant, polymyxin B. These are the members or examples of lipopeptides class of antibiotics. Now mechanism of action of lipopeptides class of antibiotics. So these antibiotics are believed to target and bind to the bacterial membrane directly and cause depolarization of the antibacterial membrane potential. The aggregation of lipopeptide class of antibiotics alter the curvature of the membrane, which creates holes that leak potassium ions. This causes rapid depolarization, resulting in loss of membrane potential, leading to inhibition of protein, DNA, RNA synthesis, which results in bacterial cell death. Spectrum of lipopeptides. So lipopeptides are used against gram-positive bacteria broadly. Administration, how we can administer lipopeptides class of antibiotics. So these are injectable. Uses are indications of lipopeptides class of antibiotics. So daptomycin is used for the treatment of serious blood and skin infections. Blood infections are a bacterial infection and bloodstream, fever, rapid heart rate, chills, confusion, and low blood pressure, etc. And also used against right-sided infective endocarditis. For this type of infection also we use lipopeptide class of antibiotic. Synthetic lipopeptides are widely used as vaccine adjuvant to enhance immune response, but bacterial derived recombinant lipopeptides such as lipo-NTR is a novel adjuvant that can be used to induce superior anti-tumor effect as compared to a synthetic lipopeptides. Lipopeptides as biosurfactants have been used in foods, biosurfactant and emulsifier, and biomedical and pharmaceutical application as antimicrobial, antimycoplasma, antithrombotic, anti-adhesive and anti-tumor agents, and cosmetics as antibacterial and emulsifier. Lipopeptides act as biocontrol agents because of their property of inhibition of growth of a variety of microorganisms including phytopathogens as inducer of systemic resistance, antibacterial, antiviral, and spreading biofilm. Side effects of lipopeptides class of antibiotics. So common side effects include nausea, vomiting, diarrhea, headache, dizziness, trouble speaking, increased sweating, pain or redness or swelling at the injection site. Other rare side effects include musculoskeletal toxicity, that is muscle pain, unusual weakness, serum creatinine kinase elevation, change in the volume of urine, swelling on ankles, shortness of breath, chest pain, mood changes, diarrhea that doesn't stop, abdominal pain or blood in stools, oral thrush. So these are some side effects of lipopeptides class of antibiotics. Resistance of lipopeptides or diptomycin has been shown to have potent activity against vancomycin resistant enterococci and methicillin resistant staphylococcus aureus. However, resistance to diptomycin has emerged over the last 20 years. Resistance to moderate concentration of diptomycin, that is from 4 to 32 microgram per ml, has been demonstrated in gram-positive model organisms such as Staphylococcus aureus and Bacillus subtilis. This resistance is normally a stepwise process involving multiple genes working together. Recently, studies on the viridans group, streptococci, and their response to diptomycin have demonstrated that rapid mechanisms of resistance can develop in these opportunistic pathogens. However, like diptomycin, resistance to SUR has also been observed in laboratory and clinical settings. So that's all about lipopeptides class of antibiotics. If you have any question, any confusion or any suggestion, so you may ask through comments. Don't forget to subscribe my channel. Thank you so much for watching.